I do want to note it's past 9 o'clock now. We've got 37 folks in the room. So that means we've reached the magic number and can actually start this morning's meeting of the Tacoma Pierce County Coalition to End Homelessness. And with that, I'd like to hand things over to Rosemary to kick us off like she always does. Go ahead, Rosemary.
Good morning, everyone, and thank you for this opportunity. I also want to say we had a lovely event last evening at Garrett's house for our monthly networking. It was wonderful to see people in person, and I hope that some of you who are unable to come yesterday will be able to make a future event on a first Thursday. So today I welcome you all to this open table where membership in the coalition means we're committed to ending homelessness in Pierce County and to engaging one another with respect. We acknowledge that we gather on the homelands of the Puyallup tribe of Indians who have stewarded this coastal home for thousands of years. We call ourselves to listen to and uplift the voices and experiences of the indigenous peoples of this land and beyond. Today, I'm thinking about Labor Day. This holiday, if we can take a holiday, interrupts our daily schedule and offers a chance to recharge. This day brings all sorts of thoughts, though, about the meaning of labor, of work, for purpose, for pay, for managing the activities of daily living, and also how this relates to the right of all people in Pierce County to a safe and secure home. I offer 3 points to center us as we begin our gathering today. First, people living without permanent housing are workers. Second, people who work as case managers or advocates may have precarious housing themselves. And third, an economic system that rejects any real increase in pay for wage workers while treating housing primarily as a financial commodity will only produce more homelessness. None of these ideas are new to you, and I won't go on by preaching to the choir, but I do want to honor the truth of how much work it takes to survive on the street, and with the constant worry of trying to control the uncontrollable. And if we need reminding, it's estimated that 40 to 60% of people living without permanent housing work at least part-time for pay. And I honor the labor of those nonprofit groups that provide job training and work opportunities for those able to work if given a chance. I raise the uncomfortable problem of staff retention in those nonprofit programs that have been unable to offer a wage that case managers and advocates can actually live on. Those who enter and continue this work because it matters, meets an emergency need, they may be passionate and committed, but they also have to pay their ever-increasing rent. And clearly the caseloads of other workers go up when some colleagues leave to seek higher paying jobs. I honor the work of all these workers as they confront the challenging effects of the housing crisis on everyone. And finally, I'll simply note the moral failures of the economic system we have relied upon in this country to determine the value of things and people. It's an advocacy success that we now have a president and a HUD secretary who've said out loud that there's a human right to shelter. This may spark more federal commitment to housing access, and the growing union movement among service workers offers a new challenge to the system of owner takes almost everything. And frustrated renters and unsuccessful home buyers may become empowered voters. Meanwhile, we continue to work on the edges and with creative fire where we can. It is a work that we can commit to doing with love, even as we rage at injustice. Khalil Gibran, in his longish ode on work, notes the power and the accountability of work done with love when he says, "It is to charge all things you fashion with the breath of your own spirit, and to know that all the blessed dead are standing about you and watching." So welcome to this Friday. And since we're gathered here together, some of you are new. I see a few new faces. So just to remind us of how we work here, we use the Zoom features of the raised hand to get access to speaking. And let's Rob keep track of who is in line to speak next. We also ask that you keep yourself muted when you're not speaking so that we don't have distractions in the background. And also, if you're doing other things, to turn your video off during the time you're doing those other things as well. Finally, in terms of Zoom, we use the chat feature for those of you who are new, as a way to interact with each other throughout the meeting. So it's very active space, and it's not disrespectful at all to engage in it in a strong way. So say what you think, ask your questions, put in your contact information, and do that in that space. And now with the time we have for a few minutes, if you're new today, we're just asking that you say hello, let us know your name, and if you represent an organization or work in an organization that we haven't maybe even heard of before, to let us know what that is, and so we can welcome you into our open table. So just raise your hand and Rob will recognize you, and we'll carry on. Toby, I guess I would recognize him. All right, thanks, Rob. Toby, go ahead.
Hi there, my name's Toby Esler. I work with Telecare for a couple of community outreach programs that Telecare has. I think I'm here both with my work hat on and my civilian hat on.
Welcome, it's good to have you.
Thank you, it's good to be here.
Rhonda.
And Rhonda, yeah.
Hi, I'm Rhonda Williams. I just kind of sort of been a spectator today. I was invited by Raquel Sager, and I hold many hats, but I'm just a person today, just a servant who's probably experienced more homelessness than I've care to even think about. But I just want to come on and see, you know, what this is, what the vision and mission is, and what the values are, and if it's something that I think that I can support and be a part of.
Rhonda, that's wonderful. It's great to have you checking this group out. We're hoping that we can honor your experience and learn from you as well.
Thank you.
And I see Greg with his hand up.
Hello, my name is Greg Watson. I was invited by Janet Husterson to come and be a part of you guys' meeting. I've opened a new sober living home in Tacoma, and I am here hopefully to make the contacts to make that service available. Was found out that you know, just because you put it there, you know, they may, you know, you build it, they may not come. You know what I mean? So, so I'm working on establishing those contacts in the community to where that could be a growth opportunity. And I don't provide the opportunity for people to our population that are living on the streets to find some shelter, but also expand.
That's great, Greg, and hopefully we can have you come on and say more about your program in a spotlight at another point. But welcome, and you can make great contacts in the chat. Just put your information in there and people will likely contact you soon.
Thank you. Thank you very much. I appreciate you.
Oh, you muted yourself there, Rosemary.
Myself. Just want to thank you all again for being here today. We now have 58 folks, and so carry on in the chat and introduce yourself if you weren't able to do it at this time, and we'll turn it back to Rob to continue the meeting.
Thank you, Rosemary, and thank you for the thoughtful and inspirational start to the meeting, as always. And welcome to all the folks who are new here. So let's kick off today's meeting with our regular segment about what's happening this week on the streets. The focus of this section of the meeting is just to share what folks who are doing outreach or in their neighborhoods seeing happening and changing on the streets. We know that there are a number of sweeps happening currently within the Tacoma city limits. So if you have information you would like to share about that. And then we also just came through yet more hot weather. So if there's anything related to the outreach and distribution of water that would be good content for this portion of the meeting as well. I open the floor, just raise your hand and we'll start sharing. So let's get started with Jeffrey.
Good morning, everyone. There seems to be a very large migration to Yakima Avenue. There are currently, well, let's see, 8th in Yakima. There are, I think 11 tents now around the corner. Between 15th and 17th, there are now 19 tents. That's quite large. I haven't visited them there yet. And if you really want to see a show, go up to 35th and Pacific and look at all the big machinery making the new sanctioned tent camp. Boy, they're spending a lot of money on this one. So we'll see how that forms up. I will probably visit with the campers next door today and see how they feel about it. Thank you.
Thank you, Jeffrey. And just so folks know, later on in today's meeting, Caleb from the city of Tacoma is not able to attend today, but I did have a conversation with him regarding the 35th and Pacific site. So I'll share some of the details about that site when we get to the government update section. So thanks for bringing that up. Anyone else with updates about what they're seeing on the streets this week? Bob?
Yeah, thank you, Rob. We've made some new connections this week that are very reassuring and making a lot of progress on this side of the bridge. We were able to, through Robin Denson, connect with Nathan Betts, who is our consistent Pierce County Sheriff representative and patrols the KP. And he is now, whether he can officially join our coalition or not, he's committed to us. We're going to have a meeting and he's going to join us next week and regularly share locations where he is meeting our homeless population. And so many of them are in cars out here and moving around. That's a significant step forward, and really appreciate Nathan's help. Gig Harbor this last week, they identified 7 new vehicles where people are living in them and parking around inside the city and just outside the city. We were able to make contact with 3 of them and at least get them resource information. We need to do better, but we're working on that. Very pleased that the West Wind Motel and Apartment Complex in Purdy has also committed to us to join and not only provide the homeless residents that are being housed there by our community financial services groups, food banks, and churches who will get them 2 and 3 nights. They're going to provide the resource list to them and connect them with TRM if they're interested. So these are big things in our little community. Just very, very appreciative that the community's taken a new sort of higher level interest in the homeless challenges we have. So more to come.
Thank you, Bob. Thanks for that perspective from the peninsulas and for the work you're doing. And Teresa.
So Bob, I just want to ask if you will put your contact information in the chat, because anyone who wants to engage with the Homeless Coalition on the Key might want to be in touch with you. Anyone who's new, Bob is a powerful force to be reckoned with on the Key Peninsula, Gig Harbor area. So I also want to say that I think most of you know that Big Mike, who is living in our community here, died a little over a week ago. And the folks here are going to have a memorial, and wanted to invite anyone who knew him. So you may know him as Michael Simon, but he's Big Mike to everybody around here. They're having a little memorial service here on the street on Wednesday at noon, this Wednesday. It's coming Wednesday at noon. So they're not really wanting a huge crowd, but if you knew him, please do come. Even if you knew him, just offer him some services. I think it would mean a lot to people to see you come here. And they're doing it at noon so that the people who run the needle exchange van, who are also an integral part of our community here, bless their hearts, so that they'll be able to come before they open up their doors for the needle exchange van. So just putting that out there. And I put my contact information in the chat already about the partner spotlights. So just be in touch if you have questions about that. And also, the people here weren't aware of the memorial services that Ed offers. And so I was thinking about, it'd be great to have some kind of little flyer that we could give to people who are in the camps, because we don't always know everyone who's passed, and they might want to come and join. The two people that I mentioned it to here were really excited about the idea that that happens, and I felt bad that I hadn't invited them before. So there it is. Thank you, Ed, for doing that.
Thank you, Teresa. And maybe we can work with Lori to just do a simple little flyer that could be handed out, printed out at home and handed out to folks. Because the next memorial is coming up on the 18th. So
yeah, happy to do that.
Great. Anyone else with updates from the streets this week? And I think I saw Richard share in the chat a ways back here.
Oh, yes, I'll talk to that. So St. Vincent's has been very helpful in the work in doing water. They also provide cooling stations, gas cards, all sorts of stuff out there. And they've got this event coming up. I posted information about that. I think it's September 18th, that Friday. And just wanted to make sure people were aware of that and encourage you to consider attending their event. Out on the street, it's just it seems like you know, Groundhog Day. The encampments are growing, as Jeffrey points out. 8th and Yakima, 15th and 17th and Yakima have doubled in size. 84th and Hosmer, I'm going to go out there after this call. They're trying to get an accurate tent count there, and then 2 pending sweeps coming forth. So pretty much same as always. Thank you.
Thanks, Richard. And I do want to note Kenneth's notes in the chat about some vigilante actions being organized over Facebook that I've seen popping up as well. So just a good general warning if you're out and about to be careful if you do end up encountering folks who are out there trying to harm those who are in the encampments. So let's move on to our next item in the agenda. If you have any additional information you'd like to share, again, please use the chat. It is a lasting resource for us, so please use that. We will move to our community spotlight, and I would like to ask Rebecca Cantrell from Ideal Option to share for a few minutes about what you're offering. So welcome, Rebecca.
Thank you, guys. Okay, so my name's Rebecca. I am a peer outreach specialist with Ideal Options. So a little bit about Ideal Options. We have over 30 clinics in the state of Washington. Most recent to Pierce County is the Lakewood Clinic. I'll drop the address for the Lakewood Clinic and the Puyallup Clinic in the chats for you guys. So currently we are treating opiate use disorder. I'm going to look at my notes so I make sure to get everything out for you guys. Opiate use disorder, methamphetamine use, alcohol use, benzodiazepine, marijuana, and kratom. Kratom is something that we have really been, as a company, we just did a huge case study on it. We're finding that, and some of you may know about kratom, some of you may not. At low doses, kratom acts as like caffeine, but at higher doses, we are seeing that it is affecting the brain exactly like fentanyl or any other opiate. Okay. And this is really disturbing because this is something that you can literally just, I mean, it's considered a supplement. You can, if you have the funds to buy it, you can go and get it. So we are currently treating, and I'll answer the questions in the chat. I think if I look over, I might get distracted. We are currently treating, and we are seeing more people for kratom use disorder, and we are treating that with Suboxone, with Subutex, and some of the medications that I wanted to talk about, just because there are a few newer, I would say, over the last couple of years that come out. We're treating with medications like Suboxone, Subutex, Sublocade. I kind of want to highlight that just really, really quickly because it's fairly new. This is a shot that someone would get, and it lasts 30 days. Okay, so it works to treat opiate use disorder. Okay, we use Vivitrol, we use naloxone, we use Wellbutrin. A lot of people ask, like, how do you treat methamphetamine use? You guys, it's challenging. It's ever growing. We're constantly doing studies. We're working really hard to really find something that's really truly effective for methamphetamine use. But we are seeing some success with Wellbutrin and naloxone for somebody with methamphetamine use that really wants treatment. It's going to kind of combat the tiredness, the sleepiness, the depression, and really help them kind of get through that first 3 or 4 weeks of methamphetamine use withdrawal. So the Lakewood and the Puyallup Clinic, I want to focus on those two. We are taking walk-ins in the clinic, and this is super important for us because my job, I do a lot of boots on the street. So I'm out in Tent City, all over Pierce County. I'm at Nativity House. I'm visiting shelters. You can actually bring somebody right to our clinic. Okay, so you don't have, if you have somebody who's like, I'm ready for treatment, you can walk up to the Lakewood Clinic or the Puyallup Clinic and bring someone to the front door and they will be seen. This is only going to be Monday through Thursday from 7 a.m. to 6 p.m. Okay. And then I have a 1-800 number that I'm going to drop in the chat for you too, where we have 24-hour nurse care team. Okay. That will 24/7. They will answer the phone at any time. And we also have that same number where you can schedule someone an appointment and get them an appointment in a clinic within 72 hours. Okay. So part of what we do at Ideal Option is the availability. We all know that the availability for treatment, it is scarce, and we recognize that. So we want to make sure that when somebody is ready for treatment, it's available. The second thing that I really wanted to talk about was our insurance team, okay? Because we are Medicaid and Medicare. Excuse me, we do accept most other insurance, but this is for low barrier. We focus on low barrier patients. Okay, so we have an insurance team. If you have somebody who doesn't have insurance, or maybe they don't know if they have insurance, or it's been a long time, we have an insurance team that's actually going to help them get situated, get insurance, apply for insurance, and help them with that. If for whatever reason, this is, I think, is amazing that we do this, because you're not going to find many treatment centers that do this. And this is outpatient, in case anybody was wondering. We actually have grants to fund someone who may not have insurance so that they are still able to get treatment. Okay. Something that I kind of wanted to highlight to you guys, and something that I'm kind of seeing as I'm out there, is just the change in the drugs. Okay. So I don't know if you guys have recently seen the rainbow fentanyl that is coming over the border as we are speaking from Oregon. This stuff is 100 times more potent than heroin or anything that we've ever seen. I think that this is something that we need to be not only talking about with the community as we're out there, but also our family and friends and children, because this is, I mean, it looks like candy. It's really, really, really scary. And then the other thing, you guys, if you are out there, please, please, please be carrying Narcan. We are seeing, and if you have a Narcan connection, please message me because I'm struggling to get my hands on Narcan. And we all should have it. And we should have more than one, to be quite honest. Awesome. We should have more than one because what we're seeing with this new fentanyl, you guys, is one Narcan isn't doing the job. It's not doing the job. It's taking up to 3 or 4 Narcans to bring somebody back to life. That is how potent this stuff is, okay? Let me read my notes really quick to make sure I didn't forget anything. I think that was it. My role as a peer, and I'll drop some of my information in the chat as well. I actually get to be with the people. So if you have somebody that's needing that extra support, I do have funds so that I'm able to Uber people back and forth to places. Unfortunately, I wish I could take them myself. And sometimes I'm like, it's that black and gray line. Where I'm like, okay, should I do this? But I can Uber. So if you're with somebody who's ready for treatment, they want support, they need resources, that is what I'm doing out here. I'm out here meeting you guys, pairing with you guys, partnering with you guys, building relationships with you guys so that I'm not only able to get them into treatment. And by the way, you guys, we are seeing numbers as high as 90% of people that engage with ideal options, truly engage with ideal options, are successful at long-term recovery. Those are really, really good numbers. And part of that is because we started something, and I hope I'm not taking up 5 minutes. I'm almost done, I promise.
Okay.
Part of that is because we started something called microdosing. I just talk about this really quickly. A lot of people had a very bad, the word on the street about Suboxone was not very good because it was putting people into withdrawal. It was putting them into precipitated withdrawal. So what Ideal Option has started doing is something called microdosing, okay? That is where we dose them at very, very small amounts of Suboxone over 7 or 10 days, okay? Some of them may continue use. A lot of times they don't have to, so that they are completely stable. And I've seen this with my own eyes. I've seen it just be so successful. 10 days completely drug-free. So again, if you guys have somebody out there and they need that extra support, they need some resources, please feel free to call me, email me, whatever you need to do to get a hold of me. And I appreciate the time today, you guys.
Thank you, Rebecca. And please do drop both your contact information and the addresses of the 2 clinics you're mentioning so that folks can access the service. And thank you for joining us this morning. All right, so let's move on to our presentation from the folks from Social Change Partners. Reed, I hand things over to you so we can talk about unified regional approach and the Pierce County Comprehensive Plan to End Homelessness.
Great, thanks, and good morning, everybody. And apologies for not introducing myself there at the beginning at the prompt. I was sitting there futzing trying to find the raise hand button. Nonetheless, I'm here. I knew I'd have an opportunity to introduce myself, so I didn't need to take the airtime anyway. So I'm Reed. I am one of 2 partners with Social Change Partners. The other is Sean Hughes. He's not able to join us today. And then Eliza Blackerby from our staff is here as well. We are recently contracted by Pierce County Health and Human Services to support planning and design of the unified regional approach to ending homelessness that is the first recommendation included in the recently adopted comprehensive plan to end homelessness. So my intention here is just to take about 10 or 15 minutes. I know that you all know the community and know the various dynamics and factors much better than I do. So my intention is just to walk through briefly who we are and what we're doing. And then I think we're going to move to some breakout groups where then we'll provide a few prompts. We're very interested in getting the perspectives of everybody here about what would make the URA a success, and in specific, how it needs to be designed in order to support the kind of interventions that are going to truly move the needle. So I am going to go ahead. I have a brief PowerPoint here. I'm going to go ahead and share that. And like Rebecca, I have difficulty monitoring the chat while I'm speaking. So Rob or Eliza or whomever, just jump in and prompt me if there's something urgent that I need to turn my attention to that pops up in the chat. So briefly, the goals for today, we just want to introduce ourselves and give you a briefest overview of what we've been contracted to support and achieve up there. And I say up there because I'm in San Francisco right now, and I'll get into that a little more in a second. And then I do want to try and do some level setting about the recommendation of the plan for a unified regional approach, so that everyone can move into the breakout session from a point of kind of reasonably, shared knowledge and understanding. But then most importantly, of course, we want to gather the perspectives that with a group of this size, we hope will be wide-ranging and diverse. We want to gather those perspectives to help us formulate our recommendations and observations that will ultimately deliver back to the Plan Advisory Board. So those are the brief goals for today. Our firm has been around for about exactly close to 10 years. Will be 10 years in January. We are currently based in San Francisco, although we do have deep roots in Washington State. My business partner, like I mentioned, who isn't able to be here today, worked in the office of Congressman Jim McDermott for over a decade. My business partner's name is Sean Hughes. He was raised in Spokane. His family is still largely up in Washington. He worked in Jim's office for, until Jim left. Let's see. Yeah, for about 10 years. Then he worked in a different member's office, Nydia Velasquez from New York City, before then transitioning to some nationwide policy work. My own background, I have a slightly less deep connection to Washington State, but I did go to Evergreen and lived in Olympia, worked with a number of community groups in Olympia and Shelton. In particular, I worked in adult education and adult literacy programs for a long time up there. That was quite some time ago. Sean and I both have deep experience in child welfare. I was a social worker with kids in foster care in Oakland, which is my hometown, for many years, and then transitioned to a policy orientation when earning an MSW degree at Berkeley, and since then have worked on foster care and mental health policy, kind of primarily, but we, for the last 7 years, have always had projects related to homelessness systems, homelessness continuum of care. Eliza from my team has supported us for the last several years, including engaging with all of the 50-some continuums of care here in California, as well as some conversations we've led in New Mexico. So I'm sitting in San Francisco. We did agree as part of our contract negotiation to come up to Tacoma as often as is necessary to move forward our scope of work. That scope of work is ultimately to help facilitate this. Actually, we responded to a competitive RFP that was put out by the county, and our ultimate goal is to facilitate a series of conversations and hopefully a series of decisions that lead to the eventually to the adoption of the contractual or interagency or intergovernmental agreements that would constitute a unified regional approach to ending homelessness in alignment with the goals of the comprehensive plan. So this is a lot of detail. We don't need to go through this. I will say we're a little behind in our original timeline, just because we only got the contract out in place a little later than we thought, and then Labor Day. So there's been a lot of vacations, but basically we're going through a series of key informant interviews, stakeholder consultations like this, doing a lot of deep research into URA models that are in operation in other states and jurisdictions there within Washington. This is just to briefly say that we are committed to upholding all of the key values that are articulated in the comprehensive plan to end homelessness. And the board actually, the advisory board that we'll be meeting with this afternoon also asked us to articulate with some specificity how it was that we were going to manifest each of these values in our work. We prepared a document with some detail regarding each of those, and we'll review it with the board this afternoon. But nonetheless, we consider and embrace and commit to not only articulating and reiterating these values, but manifesting them in our work. So what we'd obviously like to talk about today with you all is this first recommendation from the comprehensive plan, which is to create a unified homeless response system, including a unified regional approach with central decision-making authority of funding and services. That's the wording from the plan. Since then, we know that there's been a little bit of semantic kind of reconsideration. There's been references to both a unified regional approach and a unified regional office. Those two phrases have occurred in different places, different documents and conversations, including both appearing in the RFP that we responded to. And there are some who have asserted that their understanding is that that there's a significant difference between saying that we're planning for a unified regional approach or a unified regional office, then implying that there is a newly constituted infrastructure of an entity, an intergovernmental entity. And that is certainly the case in some jurisdictions. There are other jurisdictions where there is no separately constituted administrative or intergovernmental office or agency, with its own staffing and infrastructure needs, but rather the approach is a set of agreements to collaborative governance and decision making between the participating jurisdictions. So we haven't really located ourselves in that particular axis quite yet, because as we speak with folks, they're kind of some folks have strong opinions about which of those is appropriate in Pierce County, whereas others don't. But most fundamentally, clearly, a unified regional approach would unite, in some sort of committed structural way, would unite the various jurisdictions, the county, the cities, and across the regional geographies of Pierce County, which, as you all know, are of course quite vast. Would unite all of those in a structural, if not contractual way, to coordinate efforts, align resources, and then, as said here, begin to centralize decision-making authority of funding and services. Does that all make sense? I don't mean to tell you what you already know. I'm just kind of reflecting back what we've observed and what we're taking in from the conversations we've had thus far. So, whoops, there we go. So most fundamentally, we understand the decision largely to have already been made to pursue a unified regional approach, and it's down to the how. As much as it is that it's the how and the what, right? As much as it is the why. So of course, a key consideration is what do these models look like in other jurisdictions and how have they been working, right? So this is a list of jurisdictions. Many were cited in the plan, and those individuals who participated in the development of the plan did, in a previous part of that process, have the opportunity to look at these models with some specificity. It sounds like some folks who participated in developing the plan really were able to engage with the analysis and observation of other jurisdictions, whereas others a little less so. Either they weren't there those days, or this stuff could be pretty esoteric if you're sitting there looking at a contract between King County and Seattle and other jurisdictions. It's a lot of legalese and can be difficult to distill. So we assume that part of our facilitating the community's review and consideration of these other models will be trying to translate down the kind of key operational differences between these constructions. So as I said, if there's a new standalone office, that would obviously be one, right? If that standalone office actually receives and redistributes funds from each of the participating jurisdictions, that's a big distinction compared to whether it does not, right? And then what its level of authority is as compared to the other bodies that retain authority in the current construction. So those are some. There will probably be others, but we will be looking to build an analysis that compares these other models across those various points. Does that make sense? Well, let me pause for a moment and just glance at the chat and make sure I'm not.
Yeah, there's a question from Richard about whether you're hearing strong opinions about the idea of a regional office versus a regional approach.
I would say there's so far there's one extremely strong opinion in a way that kind of quieted the room, and yet it wasn't echoed or reiterated. The extremely strong opinion was about not wanting essentially additional bureaucracy, and wanting another, wanting, a collective commitment to funding additional administrative structure, as well as a kind of, so it's kind of I think an efficiency argument, and then also a recognition that some community groups that interact with multiple jurisdictions have to juggle, slightly different language and processes and forms and responsiveness and so on and so forth, and that adding one more would be again inefficient. I think the general understanding from those folks that we've spoken to thus far, though, is that the commitment has already been made to a level of kind of structure and formality in the agreement that suggests that there would be, a contractual kind of intergovernmental agreement rather than just kind of a soft commitment to, or not a soft, but a stated commitment to better coordination or whatever, or a joint committee. Approach maybe seems a little softer than what people are at consensus about, but office seems a little too far on the other end. So yeah, just to say, we're kind of just getting started in our key informant interviews here. Rob was one of the first folks that we spoke to. We started with the members of the Plan Advisory Board, and then we're broadening out from there, of course, with late summer vacations, in some cases, having stretched our timeline a little bit. We've already talked with a number of folks here. We, much to our delight, it just got a really good array of folks representing kind of different constituencies, just scheduled across our first week. So, on the left, those are folks we've already spoken with. On the right are folks that we are already calendared with in the next couple weeks. And then we have literally dozens of additional names on the list that have been surfaced by other folks. So that's one thing we'll need to talk with the board about perhaps this afternoon, is that if we interviewed everybody that we've been referred to, we would do like 100 or more interviews. So we are starting to look for ways, like the breakout groups today, to get an efficient first touch, and then give folks obviously the opportunity to speak one-on-one if they choose, and that is our commitment today. We also, in addition to this, Erica Tucci from the Cheney Foundation facilitated the distribution of a survey to a broad set of staff with different philanthropies throughout the region. So, you know, that's another way that we're, like I said, getting that efficient first touch. So let me pause, give folks the opportunity to ask questions. Am I listening? I'm looking at the chat. Sorry, let me just jump in here. Okay, I got a lot of questions here. So let me see if I can do a little bit of a speed round, and then we will commit to coming back. Right, so an additional structure that supersedes others, more or less bureaucracy. I think that's, again, as I said, undetermined. Sorry, Rob, were you going to make another suggestion?
Yeah, when we are ready to go to the breakout groups, so the way that I've got our meetings have typically worked is that we will take a short break to look at what we discussed in last week's breakout conversations, and then I'll set up the breakout groups, and we can go over the 2 or 3 questions that you wanted us to tackle today.
Okay, well, why don't I take down that sort of screen so it's not dominating the view.
Sure. Was there more content though that you wanted to cover before we move to the breakout?
No, I just you know, wanted to give folks the opportunity to ask questions here. I see there's a whole run of them in the chat.
Yeah, why don't we do that?
You want me to take a shot at these?
Yeah, definitely.
Okay. So back up to Courtney. I think that's the first one I see after the regional office versus regional approach. Additional structure that supersedes others, be more or less bureaucracy. I mean, that's a fundamental question. Like I said, I think that's as yet to be determined. We'll be looking at the efficiency of those, you know, additional administrative structures that have been established in other jurisdictions and asking folks how that's been going. Program and its effects reach into rural areas is absolutely the intention as we understand it from the Plan Advisory Board. There are obviously the county is one of the key stakeholders, so those unincorporated areas would presumably be in some ways represented by the participation of the county. I don't have an opinion yet as to whether that feels adequate to the folks actually in those unincorporated areas. We are certainly speaking with representatives of the incorporated cities and then the county thus far. And then we have community reps from rural areas that are on our list, but haven't figured out, again, how they would be represented in the negotiations. Coordination, absolutely, that's going to be a success factor. ACH model is independent with a dedicated funding source. I very much look forward to learning more.
Carolyn mentioned adding the racial equity committee of the continuum of care.
Right. Yes, we would love to, and we certainly, like I said, have affirmed values related to both ensuring that racial equity is at the center of our process and analysis, as well as the lived experience, folks with lived experience. And we have spoken to a couple of people who've identified themselves already as having lived experience, one who is directly associated with the Lived Experience Coalition, and another who was representing a different, had a different hat on, I suppose, at the time, but will very much look forward to being explicit about how that's informed our process. So yes, tribe is on the list. Tribal entity. We're looking to Garrett and some of his colleagues to connect us with a number of constituencies, including Native or Indigenous populations, as well as faith communities, and a couple other key constituencies that we haven't yet. Got it. ACH, accountable community. I'm familiar with those models actually in other well, I have a passing familiarity with those models in other jurisdictions, so I'll have some grounding when I take a good look at that. but that's a great suggestion. Outreach workers, absolutely. We've spoken to some, and look forward to talking with more. Coming back up to Kenneth's question, centralized coordination and not management. That's what we're getting at, right? Is to what extent is this an agreement to additional coordination, and what is it, and to what extent is it an agreement to joint governance and management? So we don't have a strong opinion yet, but we're gathering, like I said, diverse opinions from you all.
So to make sure that we're able to get the full 20 minutes of our breakouts, why don't we move to the quick summary that Timothy was going to provide from last week's breakout conversation? We'll do about 5 minutes there, and then we'll move to a breakout conversation, if that works for you, Reed.
Perfect.
Fantastic. So, Timothy.
I am ready. Just give me a
Okay,
second.
let me bring up the document on screen so that I can.
Coolness, and I just dropped it in chat if anybody
Perfect.
wants to easily download it. So we had a very fruitful discussion last week around making space for people with lived experience to share their experience in ways that'll have an impact. And as always, I led off with the inspirational poem that Rosemary offered last week. And this one challenges us to be ablaze with daring. And just wanted to remind people of that very appropriate message for our times. We have a long list of ways to encourage and support lived experience voices. And instead of going into each one of these bullet points, I'm just going to point out kind of the clusters of themes within here. Starts off by just talking about the importance of a welcoming posture and being open, which is some pretty fundamental stuff. And then there are a number of practices for practice recommendations for bringing lived experience voices into organizations and the importance of doing that just structurally to our work. Then still on the first page, there are a cluster of ideas, thoughts on engaging lived experience people in communications work and policy making. Moving to the second page, up at the top of that, there's a cluster of ideas on basically how to structurally support lived experience voices. There's just a lot of depth in what came up last week. Moving down to around the middle of that page, there's a number of ideas around engagement and support for storytelling in particular. And then after that, some thoughts on how we can use technology to support that storytelling and broaden the reach of those voices. And then finally, at the end of that first set of bullets, there are some thoughts on supporting leadership development within our own organizations and groups and how to elevate lived experience. And then there are a list of just kind of observations that came up. Starting with, I really liked this first bullet point here, and it's just, we talk about this a lot, or I do anyway, recognizing our own classism and how that can color our view. Then after that is another really interesting comment that we could spend a lot of time discussing if we wanted. And I think that this was kind of geared at the counts that come out of the sweeps where we talk about what services are offered to people. And That's usually a fairly dismal percentage compared to the people who are being swept. And this offers the observation that, you know, just because somebody accepts services doesn't mean that they go all the way through the chain of events required and actually get services. And then finally, on the third page, there's a cluster of ideas around how the importance of recognizing the impact of trauma and ways to bring that perspective into our work. I've gone on for a while, so I think I'll just stop there and you can read it more thoroughly for more detail.
Thank you, as always, Timothy, for adding value to the conversation we had last week. And this week, because we're going to be doing something a little bit different, we're going to actually do two things with the information that comes up from our breakouts today. It's still going to be just as critical, if not even more so, to share your information from your breakout room in the chat when we come back. So somebody please take as detailed a notes as you can. But we're going to supply the raw materials to Reed and his team, as well as the summary that Timothy pulls together, because we will have asked Timothy to go ahead and do that, the same sort of exercise again as well. So hopefully having kind of both Reed will help with your process on your end and make sure we can make the most of this time. I know we are shifting things around a little bit in the agenda because we're running a little bit behind, but I think it's important that we spend time today, since we have Reed and Eliza here, to gather this information. So Reed, were you able to boil this down to like 2 or 3 things that you want folks to consider, and maybe you can describe those, and then I'll send people to the breakout rooms.
Sounds great. Yeah, well, actually, the report that we just got from last time really is a comprehensive, I think, address of one of the key questions that we included, which was to, you know, what are the key success factors for ensuring that we engage the wisdom of people with lived experience. And so, obviously, we're interested in as much more as folks want to say about that. But, you know, and we will draw on the notes. I downloaded the document, so thank you so much.
Perfect.
I think, you know, for us, the main questions we want to get at here are, you know, how folks think that this URA can and or must support the efforts across jurisdictions, but in the jurisdiction in which you practice, of course, to address homelessness. Right? What difference would the unified regional approach make? And then how do we know, essentially, when we're looking at other models that have been in operation in other jurisdictions for a while? King County is obviously one, Snohomish is another, and then there's a set of others. But when we look at those and report back to the board, what are we looking for? How do we assess not only their effectiveness in addressing homelessness, but also whether they are workable here in Pierce County? So that's really the heart of it, you know. And then, you know, if you are someone who has a perspective on a specific array of strategies that you know are needed in your community, then obviously that's one of the lenses to bring. How would a URA support the implementation of those?
Great.
Make sense?
I think so. Actually, no, I'm seeing Jan shaking her head no. What?
Can you
what's
make
confusing?
those 2 points in 8 words or less?
Yes. How would we know if a URA model that is in place somewhere else is appropriate to Pierce County? And what will a URA do, or can it do, that's not currently being done?
That's helpful.
Better?
Not much.
Okay. Thanks, Jan, for asking that question. Let's go ahead and jump into the breakout rooms. I will try to send a short version of the questions as well to the breakout rooms once you're there. So what we're going to do is go until about 10:22 in the breakouts. So hopefully have a good, rigorous conversation, and away we go. Please take good notes. So welcome back, everyone. Hopefully that was a fruitful conversation, and folks were able to share a lot. Whoever was taking notes in your room, please make sure you paste those into the chat. It's critical that we get those to Reed and his team. And Reed, anything you'd like to say in closing before we move on with the agenda?
No, just so appreciative of folks' time and perspective. I will put my email address in the chat, and please feel free to email me with additional suggestions or if you want to talk more.
Thanks, Reed. And see you this afternoon at the advisory board meeting. So, all right. So again, please paste your information from the chat, from the breakouts in the chat when you get the moment. And we will move on with our agenda. I want to apologize to our government friends who have had to wait longer than usual to give updates today. I appreciate your patience as well. Real briefly, I mentioned earlier that Caleb Carbone from the city of Tacoma is not able to join us today. But I did want to pass along, there were a number of questions about the upcoming the creation of the mitigation site that's being created at 35th and Pacific. I had a phone conversation with Caleb yesterday afternoon and wanted to share some answers to a few of those questions. So he wanted to let me know that yes, the groundbreaking grading of the entire site is happening right now. The site is actually going to be split into two pieces. The north part of the site is being graded, but will not be the site of the mitigation site. The mitigation site will actually be on the south end of the site. They are actually doing some prep work ahead of time right now so that when the site opens here in late October is the plan, it will initially open with tents, but next year in the summer and June timeframe, it will transition to being micro shelters. So they're doing groundwork to set up the infrastructure for that when it happens next year, rather than having to go back in and do duplicate work. He said that he is aware, and the Tacoma Rescue Mission are aware that we would like to have them come talk to the coalition when the time is right. Right now, the city and the Tacoma Rescue Mission are still negotiating the contract for the running the site. But there was question about the cost for the infrastructure work that's being done now. Caleb said the estimate is around $800,000. The contract that will be done with the Tacoma Rescue Mission is a little over $1 million for the operations of the site. And I believe that's for the full 2 years that it'll run as a mitigation site. But that's still being negotiated. The site will have case managers on site, community-based workers, and also provide some workforce development. They also will bring in trailers with showers, restrooms, and laundry on site. So that's kind of a brief overview. He did say that it will be set up somewhat similar to the temporary emergency micro shelter sites run by Lehigh, in that it will have fencing around the site and one point of entry, very similar to what we've seen at those sites around the city. And it is meant to be to have lower barriers to entry, so much more like the stability site that's down in the tide flats than the other sites that are being run across the city. So I can't pretend to be Caleb, and I don't work for the city of Tacoma, but I did want to relay that information since there have been so many questions. Let's shift gears and let's see, Jeff Rogers, I see you're on the call. Would you like to offer updates from Pierce County Human Services?
Yeah, just want to remind everybody that we have a funding opportunity that's currently open. It is the COC Supplemental Unsheltered Homelessness No NOFA. It's targeting unsheltered homeless and moving them to permanent housing. Applications are due by next Friday. I believe next Friday is September 9th. I can't believe it's September 9th almost already. Wow. Summer is over. We encourage agencies to apply. Our COC routine NOFA closed earlier this week. Unfortunately, we only received one new application, one new project that applied. The other projects that all applied were 12 renewal projects, but we like to see new projects come in and apply. So we encourage you, if you're interested in receiving any of these funds to provide permanent housing for unsheltered homeless, that you would apply and submit your application by next Friday at 4:30 p.m. All the information can be found at our Pierce County Human Services website. That's it.
Thank you, Jeff. And let's see, do we have anyone from, just a second. Looking at who's on the call. Anyone from, yeah, I was gonna call on you there, Adam.
Jenny is out, but they forwarded on some talking points, which again, not my area of expertise. So I'm just going to read what she's got. Okay?
Adam, I can jump in whenever you need. I work directly with Jenny and I'm in COVID.
Thank you. Actually, I'm going to pause real quick just to. Garbage day. Okay, so COVID update and monkeypox. COVID cases continue to trend downward. There are still home test kits, or no, free home test kits from the federal government are ending Friday, but there will still be, Department of Health will still continue to supply home test kits. I can put that website in the chat. There are some updates on vaccine boosters. They're going to be here soon. The FDA authorized new and improved booster shots from Moderna and Pfizer for emergency use. Further review should be complete next week, and those doses are going to be available soon. These COVID-19 vaccines that have already provided strong protection against hospitalization and death. This vaccine offers more protection as it targets both the original COVID-19 strain and the currently circulating Omicron variants. And these vaccines are going to be more similar to those annual flu vaccines that target different flu strains. FDA authorized the Moderna booster for everyone 18 and older at least 2 months after that vaccination. There's lots of that type of stuff happening. If you're scheduled to get a booster, go ahead and get it. You may have to wait a little bit longer, but the booster will provide better protection. So if you have the availability of getting a booster, do it. Monkeypox. DOH established a hotline to answer questions from the public regarding the monkeypox. There is a hotline phone number that, again, I will drop in the chat. Monkeypox, as a reminder, is mostly spread through close skin-to-skin contact. It's far less likely to be spread in the air. The monkeypox virus can be transmitted in person-to-person contact, primarily most common through direct contact of skin or bodily fluids with an infected person. Contact with virus-contaminated objects like bedding, clothing, towels, if you're at a gym, that kind of thing. Less likely during our current outbreak are those respiratory droplets, but that is still possible. Initial symptoms are flu-like, fever, malaise, kind of like tiredness, headache, feeling weak, and that's kind of the beginning of the symptoms. Lots of times it can be missed or mistaken for HSV, syphilis, folliculitis, I think, and abscess. I apologize, I'm just trying to understand words that I haven't read before. Lesions typically begin to develop simultaneously and evolve together on any given part of the body. The rash is extremely painful, and then it kind of scabs over and works its way out in a week or two. So if you do know anyone with an onset of a rash of unknown origin, please reach out for medical attention immediately. If they don't have a medical provider or insurance, they can call the health department for a referral. And I will put that phone number in the chat as well. Again, while this is currently disproportionately impacting the LGBTQ plus community, anyone can get it regardless of sexual orientation or gender identity. This one is for all. And there will be some vaccine clinics for individuals who are eligible, and I will put information on that in the chat as well.
Thank you, Adam.
Joey, yeah, sorry it wasn't as clear and concise as Jenny's. But.
It's all in the delivery, Adam. So you got it. You're here. It's awesome.
Just a few things I wanted to touch on. One, in addition to the new booster that's coming out, part of that process is they rescinded the EUAs for the current boosters, the one strain ones that we've all been getting. So if you know anyone that has a booster appointment in the next week or so, they're not going to be able to get that. That will need to be rescheduled. We expect supply to be a little slow, but this is a priority community for us. So if you work at a shelter and want to bring us out, any of that, like, please get in touch. We'd love to do that. We expect vaccine to be approved and in hands in about a week. With monkeypox, a couple points. The department is still working on getting proper language to talk about this. But I really discourage folks to talk about this being a part of the LGBTQ community. It makes it sound like it's the entirety of the community and divorces it from what's really happening. Almost all cases are in men who have sex with men. There are a couple cases in trans men who are part of those sexual networks. And places, people can also develop that rash and those sores internally. We're seeing a decent amount of that in throats and other internal spots. So if someone develops a sore throat that seems a little different, definitely still get them to a doctor. What else was I gonna say? I think that was it. If anyone has any more specific questions, go ahead and throw them in the chat. I'll probably answer.
Perfect. Thank you, Zoe. All right, so moving on to our next regular government report out. Valerie, do you have anything to share about rental assistance? And maybe Valerie stepped away.
Sorry, I'm here. Can you hear me?
I can, yeah.
I was switching laundry. Let me turn on my camera for you. Yeah. This is what it looks like your first week when all of your children go back to school. It's just total chaos. So rental assistance, shortly after the COC NOFA that Jeff Rogers mentioned closes, we will open our eviction prevention NOFA. We're looking at 1 to 5 agencies. This first year, we have about $6.8 million. And it is ongoing fund source through House Bill 1277. So I encourage folks to start preparing for that NOFA. It's going through the timeline as we speak, and I'll make sure the coalition has a copy. But other than that, everything else is great. We're just trying to figure out and get the last bit of our dollars down. So thank you to the city of Tacoma, Tacoma Pro Bono, Dispute Resolution Center. Like, it's just been a team effort. It's been a team effort and our 9 amazing nonprofits. So yeah, still happy landlords, very stabilizing tenants, just moving through.
Great, thanks Valerie, and thanks for the long marathon you guys have been on.
Yeah, like the 2 years that just won't end.
Yes, exactly. All right, and Teresa, you briefly had your hand up. Did you have a question you wanted to ask?
I was just checking about, there are some agencies that offer laundry services. Is there anything in particular that is different about how clothing needs to be laundered to keep people safe? Just regular washing, doesn't matter if it's dried or not? in the dryer?
Those are good questions that I bet Adam doesn't have answers to.
Do you not, Zoe? Do you have an answer to that, or should I check back and I can follow up? With
You repeat it. I'm sorry.
Just checking people who offer laundry services, the how to keep clothing from spreading such things. Does it matter if things go through the dryer? Can you do just a regular wash on them to keep people safe? What's up with that?
I don't know the answer to that. But Adam, if you want to check, or I can check with my team. Most of my team is activated for monkeypox right now.
I'll check.
I was typing in the chat, but just while I have the floor, I forgot one thing. One of at least my biggest concerns about monkeypox reaching the homeless community in the shelter system is via men who have sex with men that are doing sex work. If you know anyone that's doing this work that you feel comfortable talking to, please encourage them to get vaccinated. You do not have to have symptoms, or you know, we're encouraging folks that have had a direct contact, but with folks that are in any way, whether that's for as work or not, part of that community, they can get vaccinated. We are hosting vaccine clinics. And I think there's an opportunity for us to come out to a shelter doing homebound, whatever, and get that vaccine there as well. We'll see if I can get the flyers about upcoming monkeypox vaccine clinics out.
Thank you, Zoe. Okay, so let's move on with the rest of our agenda. And we'll have to be a little bit compressed here at the end of the meeting because we are running behind. The next item on the agenda is an update regarding the Pierce County Comprehensive Plan to End Homelessness. I think it's been referred to a couple of times today that there's a meeting of the advisory board that takes place this afternoon from 1 to 3. I'm going to put in the chat the link to the that you can use to attend that meeting if it actually pastes for me here. I may have to do it after doing this update, but I will share the link to the Zoom link for that meeting this afternoon, again from 1 to 3. The public is invited to attend those advisory board meetings, and there is opportunity at the end of the 2-hour meeting to provide public comment and ask questions if you have an interest. So took forever for some reason for that to post into the chat, but there is the link. So there's that. Any questions about that this afternoon's meeting for the comp plan? All right, not seeing any. In the interest of time, the only thing I will mention for the advocacy update is that a couple of quick things. One, the city of Tacoma has not yet posted the agendas for meetings next week, other than the Community Vitality and Safety Committee meeting that happens on Thursday afternoon at 4:30. There's nothing on that committee agenda for next Thursday that's directly related to our work. However, they are going to be talking about the system that they're going to be using for dispersing the 0.1% funding for substance use and mental health. So some of us may have an interest in listening in on that conversation next Thursday at 4:30. Another reminder is that on September 13th, the study session, it does include a homelessness system update. And if there is conversation, you might recall last week we talked about whether there was a proposal for a camping ban of some kind being discussed within the city of Tacoma. If there is a proposal that's going to come up, the discussion would likely happen during that study session. So that's another one to put on your calendar for next week, the week after next, not next week. So that's all I'll share for advocacy. Let's shift over to Safe Sites for All. Jan, what would you like to tell us today?
Number one, we will not meet this coming Monday. This coming Monday is Labor Day. Go out and celebrate your favorite worker. but we will resume after that. Number 2, we talked about the weather. I want to thank Jeff Rogers, who kept us posted as to what the weather is. And we did not need to meet, but he offers a platform for those of us who respond to the weather to meet, and it did not rise to that level this week. So thank you, Jeff Rogers, for being caring. And also I want to thank Caleb from the city of Tacoma. He allowed outreach teams to go down to stability site with the 85-degree weather. And I want to thank our partners that were available and used by outreach teams. New Hope out in Puyallup, St. Vincent de Paul on the south side, and the stability site on downtown area. So thank you, everybody. We are going to have a debrief. We tried to have one last week, but we had a computer glitch. A debrief on the weather is coming up on the next Monday, which is September 12. Be there at noon for any comments about weather response, past, current, or future. And Caleb will be there to represent the city of Tacoma's involvement. And the third thing I want to say is we're a safe parking site. Very pleased that Jeffrey Boyce is a pastor in many ways. And one thing he is shepherding right now is he is the host of a new safe parking site at his church on the south end, South 96. The Episcopalians, gotta love them. But Paula Anderson, our chair of our leader for safe parking, is looking for new partners, new sites, and the county has now allowed even non-faith-based groups to offer their sites. So you could go to our website, go for Safe Parking for All, go a little bit deeper, and you'll find Paula's contact there. That's it. Happy holidays, everybody.
Thanks, Jen. And any other coalition committee updates? Rosemary, anything to share there?
Not today. I think we'll wait when we have more time.
Great. I see Adam, you have your hand up. What can you tell us about the housing committee?
I've messed up a doodle poll. Good morning, everybody. So the housing subcommittee, our work group, is going to be up and running soon. I was just checking the doodle poll results to tell you when our first meeting was going to be to discuss how often we like to meet, what our goals are, and things like that. Realizing after the fact that the doodle polls aren't as detailed as I was like, and so it kind of has a really vague window of time that I was asking people to commit to. So I will again be I'm going to put my information in the chat if anyone else is interested in participating in this group. And I apologize to everyone else who already filled out that doodle poll, but I will be sending you another email with better information. And then I also
mean you weren't proposing 4-hour meetings?
No, not at all.
I mean, you wind us up, we might go for 4 hours.
That said, I appreciate everyone's commitment because there was a lot of yeses in those time slots. So I'm sorry, I will send out a better thing. But yeah, I'm putting my email in the chat right now if anyone wants to participate in the housing subcommittee of the coalition. And
great.
Isn't a coalition specific update, but I guess go to the order. The health department still has posted its homeless liaison position, focusing on environmental health. So kind of helping us establish our internal coordination around homeless response, and also working to support folks experiencing homeless during environmental health events like heat waves and cold and that type of thing. This position will be open until September 11th. I encourage you to check out the application on our website. I did hear from an applicant that if you get a notice through like LinkedIn or something, or not LinkedIn, but Indeed, Indeed, well, the example was Indeed. Indeed shows the qualifications higher than they actually are. It's kind of like so there's more detail on the website. If you go into the questions, it's a bachelor's degree is not required. There's an element of education, lived experience, work experience that we value. But if you go through Indeed, it's like, oh, you don't have a bachelor's degree, don't apply. And that's not true.
Fantastic. Thanks, Adam. And you jumped right in there. We are moving over to our Good Trouble announcements. So anyone else with items for the good of the order that they would like to share with the 45 of us who are still here today. I think maybe we're worn out and we're ready to get to a 3-day weekend. Possibly. And Adam, just so you know, your hand's up. I'm presuming you don't need to talk more.
He's giving you a high five.
Yeah, there you go. Thanks, Ryan. And Richard, I see your note about what's a weekend. Yeah. All right. So, seriously, any other good of the order announcements folks have to share? All right, I do like to carve out time at the end of the meeting to reflect on each day's meeting. If you have comments about things that worked well, didn't work well, we need to do better next time, I need to do better next time, please, you can speak up now or you can put them in the chat. Our goal is to always improve these meetings, so appreciate everyone being here and committing to spend the time. And the last item on our agenda is, does anyone have a success story that they would like to share this week? I see your message in the chat, Lavada, about the Veteran Village, and thank you for the water. That's definitely, there's so many thank yous to go out for all the water over these last few weeks. I think we can all be happy that looks like the hot weather is about to be behind us. So Anna, I see you have your hand up. And you're muted right now.
Here
There
we
you
go.
go.
So I just wanted to give a big shout out of appreciation to the folks at Tacoma Housing Authority. They have just been really bombarded with a lot of referrals that IPPC is sending their way, and they're doing a fantastic job with trying to catch up there. I think they're going to be reopening their doors as far as accepting vouchers again or referrals. And I've been speaking to a couple individuals there, and they've just been very flexible and very accommodating with my efforts as far as some of my cases go in getting these vouchers through and getting people started up with some emergency housing. So kudos to Tacoma Housing Authority. Those
Thank
are
you
rock
for
stars.
that, Anna.
Very big rock stars for Inside Passages.
Great. Well, on that note, any last items that folks want to share before we close up today's meeting and get on to the rest of our Fridays and a long weekend, whatever that is? All right. Yeah, there you go. Take a nap. All right. Thank you, everyone. And as always, if you have an interest in helping us plan upcoming meetings, we're going to take about a 5-minute break. And then folks who want to help with planning, we'll be back here in the same room in 5 minutes. So thank you, everyone. Have a safe weekend. Enjoy.